Hey guys, in this video I'm going to be talking about the side effects that you can experience with the prescription drug Glipizide. I'll go over what it does in the body, which will help you understand why you see some of the more common side effects. I'm also going to talk about three groups of people that want to be really careful when they take Glipizide. If you're looking for options outside of drugs and surgery, also go to my website at curtis-alexander.com and there's a free report there for you. Hopping right into it. So glipizide is what we call a sulfonylurea, which means it goes into the body and it stimulates the pancreas, the beta cells in the pancreas, to produce insulin. It also causes the amount of glucose that's kicked out from your liver to go down, and in your periphery, your outside body tissues, you're going to see the insulin sensitivity go up. Now, in theory, a lot of these things are good things, but when you start secreting insulin, we see some other side effects that can pop up. So the most common ones we can see, and from a percentage standpoint, they're not actually that high, but they can be problematic. So first of all, nervousness around 4%, tremor, which you can see are kind of similar, 4%. Hypoglycemia, we'll talk about this one in a second, that's low blood sugar. It only occurs in 3% of people, but again, we'll talk a little more in a bit about that. Dizziness, 2 to 7% of people. You can see diarrhea, 1 to 5%, and then some people do actually get gas from it. So now let's talk about the three groups of people that we need to be careful with. The first of those groups, is anybody with a heart condition. So what they found is that when glipizide went head to head, they found that diet and insulin had a lower mortality rate than giving them glipizide in people who have had serious heart issues. Doesn't mean it's a no-go, but it's definitely something they steer people away from doing. So talk to your doctor about that one. The biggest issue, the biggest concern we have normally with people is their blood sugars get too low. Again, when you're secreting insulin, you're going to see sugars go low. All right, so one of the good things about glipizide as far as causing hypoglycemia is it is a shorter acting sulfonylurea. It's one of the shorter acting drugs in this class. So if low blood sugars occur, they tend to be shorter acting. It is dependent on the dose you give, so the lower the dose, the less chance of it happening. And it can be affected by other drugs. The big ones we want to keep an eye out for are antibiotics, fenofibrate, which is a cholesterol-lowering medication, and then warfarin are three of the big ones. Obviously, you always want to run a drug interaction check no matter what, but these are three to watch out for. People who are in caloric deficits, meaning they're trying to lose weight, can have a lot of hypoglycemia trouble with the glipizide. If you're drinking the alcohol, that can affect it. Also kidney and liver function. So we just spent like a minute talking about these groups of people that can put you at higher risk for low blood sugar. So like I said, it didn't occur in a lot of people. We look at 3% and think, well, that's not a big problem. But if it happens with glipizide, it can be serious. So it is something you really want to watch out for. And lastly, you'll hear people saying, it used to be 20 years ago that if you had a sulfa allergy, like sulfa antibiotics, they were like, well, you don't want to use glipizide because it's a sulfonylurea, so it has a sulfa group on it. But what they found is while you still want to use caution if you have a sulfa allergy, they aren't really seeing the same sort of types of cross reactions with people who are allergic to antibiotic sulfas and non-antibiotic sulfas like glipizide. So can a serious hypersensitivity reaction happen? It can. It is unlikely, but it's something that you need to know about. So if you've taken glipizide, let me know in the comments. Did you experience side effects? If so, what were they? It's really helpful for me, and it's very helpful for the other people that watch the video to learn from your experience. So let me know in the comments. I hope this was helpful, and I'll see you in the next one. Thank you.